Controlled chaos. That's how an ICU doctor working at Juravinski Hospital in Hamilton describes what's happening there right now.
I've been practicing intensive care medicine for 6 or 7 years now, and we've never seen anything like this before. And even in the first and second waves, didn't experience anything like this.
Dr. Bram Rochwer says they're stretching to every nook and cranny of the hospital to add additional beds for critical care patients. The biggest challenge, finding human resources.
Our nursing colleagues, our respiratory therapy colleagues, PSWs around the hospital, our dietitians, physiotherapists.
Juravinski Hospital is using nearly double the staff they normally would by training healthcare workers willing to help out in the ICU.
Super appreciative for those folks that have come down to help us out. But to say that they're functioning at the same level as somebody that's practiced intensive care medicine their entire career, it's just not the same.
Ontario is preparing for the worst case scenario, otherwise known as triaging. That means choosing who gets the best care and who gets palliative or end-of-life care. Today, the province is reporting a staggering 900 patients in the ICU with COVID-19. Health officials say they'll have to enact the triage protocol if numbers surpass that.
We need to do absolutely everything that we can to avoid this scenario. Redistribution and load leveling of patients across the province has helped avoid this. We've done our part in Hamilton as well, and we've helped offload some of those Toronto area hospitals.
According to Critical Care Services Ontario, there were more than 400 patients with COVID-19 in the ICU at the beginning of April. That number rose each and every day and has since more than doubled.
Critically ill patients have gotten younger. Our youngest patients now are in their 30s. We have patients in their 30s downstairs on life support, critically ill with COVID, and our oldest patients are only in their early 70s.
Without the stay-at-home order, Rochwer believes we would have been in an even worse situation. Through it all, he remains optimistic.
I think there are early signs of hope, and early signs of hope that we can get through this, and the summer might be a much better place. And I think that's what keeps us positive, right? And keeps everyone sort of moving forward, is that they're different than waves 1 and 2, that there might be a light at the end of the tunnel this time.
Rochwer and other doctors say the way to get us out of this third wave is through vaccinations.